Each year, hundreds of thousands of women elect to have breast augmentation surgery. Now there are new gel-shaped implants that has been recently approved by the FDA for use in breast augmentation. Here to tell us more about that is Dr. Tattini with Twin City Plastic Surgery. Thanks for being here.
Thank you for having me.
So we're talking about a lot of breast augmentation in the country. Talk about, in the beginning, how this is changing and how it has changed over the last couple of years.
Well, breast augmentation is now the most common cosmetic surgery performed across the country. As a matter of fact, over 300,000 people have now participated in that surgery just in 1 year. So liposuction is now the second most common. It's always been the most common, but breast augmentation is now the most common. So.
And now we were mentioning this new implant. So talk about the progression of implants since breast augmentation started.
Sure. I brought a few with me. This is a saline implant. This is the so-called saltwater implant that's been around for decades and is very safe. And if it ruptures, you know right away because the saline is just absorbed through your body. This is a very common implant. This actually is an implant that's more common. This is a silicone gel implant, and 72% of all breast augmentations performed last year were silicone gel. It's a softer feel. Some women are still concerned about the safety effects, although a lot of the studies were unsubstantiated back in the 90s.
Yeah.
But this is the new implant. If you notice with these two implants, these are round. This new implant is a silicone gel product, but if you look, it's a little bit more anatomically shaped, so-called teardrop, if you will. And it's also textured. That's a smooth round gel implant. This is a textured, anatomically shaped implant, so it just gives a woman another choice, whether it's augmentation for cosmetic purposes or even reconstruction purposes as well.
Now, I have the question of how safe is it? I would be intimidated to have any sort of surgery like this done, and there's always a risk that it could break or something bad could happen, but how safe is it?
I mean, they're very safe. I mean, they're all FDA approved, and in order to get any product approved by the FDA these years, especially with what happened in the early 90s, there's a lot more scrutiny involved, and all of these implants have been studied over 10, 15 years through adjunct studies, and so rest assured, once they're FDA approved, that's a nice, not necessarily guaranteed because nothing's guaranteed, and obviously they're still doing studies, even though they are FDA approved. But nowadays, we tell patients, rest assured, that they've been studied.
So it's a popular procedure, and even more options now available to people.
That's correct.
All right. Thank you, Dr. Tattini with Twin Cities Plastic Surgery. We'll put up more information on our website. Thanks for being here.
Thank you.